Good day, everyone. Today we shall be considering very essential topic: first aid. First aid, immediate care for emergency. What then is first aid? When we say first aid simply means the immediate medical treatment given to someone injured or suddenly ill before professional medical help arrives. It is crucial for saving lives and preventing conditions from worsening. So the essence of first aid is to save lives and to prevent the life or the condition of the person from getting worse. Okay? So what is the aim of first aid? From the definition, number one is to save life. The primary goal is to preserve life that is in critical situation. Number two is to prevent the situation from getting worse, to stop injuries from escalating and causing further harms. And third reason or third objective is to reduce pain. First aid helps to alleviate suffering as much as possible until medical professionals take over. So the person giving first aid is not actually a professional, he's just an assistant of the professionals till their arrival. Right? Having said that, what are the common accidents that require first aid? Number one is suffocation. Suffocation occurs when there is lack of proper ventilation in an environment. Okay? When there is no enough air in a building or in a room, it can lead to dangerous suffocation, especially in workshop. When you are in the basic technology workshop and it's not well ventilated, it can lead to suffocation, but it can also happen in any other place. Another common accident that might require first aid is cut. Cut is caused by sharp objects like knives, glass, scissors, a blade, resulting in opening of the skin. When there's a cut, you see that the skin is open, and then, of course, bleeding will follow. It occurs as a result of sharp objects. So these are the two common accidents that might require first aid. We have other accidents too. Now, let's understand what injuries are. Injuries could be in form of bruise or in form of burns. When we talk about bruise as a type of injury, it occurs from a blow or a fall. When somebody gives you a blow on your face, what the reaction on your face is known as bruise. Or when you fall down and hit your face on the ground, the result of that effect is known as bruise. It usually leads to bleeding under the skin, but the blood will not gush out. Okay, the blood will be within the skin, but it will not come out of the skin because it's not a cut; it's a bruise. Usually, that place will be reddish, but the blood will be under the skin. On the other hand, fire accident is what cause burns. Okay, fire accident is highly disastrous. Often they come from an inflammable liquid or faulty electrical appliances. Because we have two major types of fire: the one from chemical, which is inflammable liquid, or the one from the electrical appliance. So this one can lead to what? Burn when they touch the skin. Right? So another accident that may occur, which we need first aid, is electrical hazard. We said it before previous slide, fire hazard. So when you touch an open socket, a naked wire, okay, it can cause electrical shock. Okay, and this usually is caused by careless handling of electrical appliances. If you don't carefully handle electrical appliances and you are touching the plug when it is under electricity, it might lead to what we call electrical shock and may pose serious risk. These are different accidents that may require first aid. We're just looking at accidents that may require first aid now. Okay, now what then are the first aid box? The first aid box, you can see it here, is a container for medical supplies. Usually it's in form of white color and it has a red addition sign or plus sign. Okay, it should be clearly marked. This sign should be clearly marked so that anyone that sees it will know that it is first aid box that contains all the medical supplies, or that rather some of the medical supplies that may be needed for the operation. So it's in a rare case that you see the plus sign in white color. Usually it's in red color, and then the container itself is painted white. Right? I want to note that. Let's now talk about the content in this first aid box. There are a lot of content, medical content in this comfortable box. We're going to talk about just 5 of them. One of the content is the cotton wool and pin. Inside the first aid box, you will find the cotton wool and the pin. The cotton wool is for cleaning wounds and securing dressing. So when there is any wound, you get the cotton wool to clean up the wound. Okay. You can also find Vaseline and blade inside this first aid box. What they do is to protect barriers and for specific wound care. Okay, so you put on Vaseline to work for protections. Okay, and also caring of the wound. You can also find an instrument or a device called thermometer. This is used to measure the temperature of human body. Usually the clinical thermometer, because we have different type of thermometer, but the one for the human being is for the human body is known as the clinical thermometer to measure the temperature of the human body. Because the temperature of human body should be approximately 36.7 degrees Celsius. So when it is above or below, then there is need for first aid. In the first aid box also, you can also find bandages in different sizes. What these bandages do is to cover and support injuries. And another content inside the first aid box, one among many, is the antiseptics. These are creams or fluid like Dettol for wound disinfections. So we have many of them and so on and so forth, but we just want to look at this 5 in the box, the first aid box. Okay, now how do we apply simple first aid in some situation? In a case where you have cut or bleeding, what you need to do is to clean that cut with cotton wool and iodine. After then, you apply penicillin ointment and finally cover that cut with plaster. It's as simple as that. Then you can now call on the medical personnel or you take that person to the hospital for further treatment. Another situation is snake bite, where there is a snake bite or scorpion stings. In this case, make sure you get a rope and tie the point where there is the snake bite. You tie above that bite. The reason why you are tying above that bite is so that the venom does not transfer through does not transfer it poison to all the part of the body. So you tie above the bite and you make small marks with a razor blade to drain poisons. So we get a razor blade and make some cut within that place of biting, and so that it can drain away the poison. Then you quickly rush that person to the hospital, or you call the medical personnel for that treatment. Another area of application of first aid is when someone have high fever. What you need to do for that person is to remove the clothes of the person and then get a wet towel to cool the body temperature, and then you can now call the help of the medical personnel. Lastly, when there is a case of dog bites, very simple, quickly clean that area of bite with Savlon and then apply iodine or TBC. Okay, then seek for anti-rabies treatment immediately from the medical personnel. So there are other areas of application of first aid, but we are choosing to talk about these four. All right. Now, there are severe incidents also that we need to respond to, aside from the one we have mentioned earlier. There is a problem of the respiration when somebody is having issue with the respiratory tract. People cannot breathe well. When you have a situation of a victim that cannot breathe well, what you need to do firstly is to lay the victim face up, as you can see here. The face of the victim should be up. Then gently press the belly, as you could see them doing here. Gently press the belly to release the water, and then you can now perform mouth to mouth if there is need. Mouth to mouth resuscitation. So if you press the belly gently and the person is not still breathing, quickly perform mouth to mouth resuscitation by putting your mouth in the mouth of the victim and then you blow, okay, so that the person can regain his consciousness. Another severe incident is where you have broken arms. When somebody breaks his arm, all you need to do is to dress the wound that has been sustained. Then you support that place with a ruler or stick. Then quickly rush that person to the hospital for further treatment. Another severe case or incident is when hot object or palm oil falls on the skin. Quickly clean that area with Savlon, then apply Gentra Violet or Dermasin cream. Okay, thereafter you can now give antibiotics if available and then rush that person to the hospital. Lastly, when there is a case of electric shock, first thing you must do in this case is quickly switch off the power source, the point where the electricity is being supplied, turn it off before any other thing, then get the victim laying down to rest and give that person milk if necessary. All right, so it is very essential that you know all the steps so that you do not worsen the situation, because one of the objectives of first aid is to what? To prevent the situation from getting worse. Okay, so do not take any step that you don't have knowledge about. Right. Now, there are cases of convulsion and epilepsy. When somebody has convulsion, all you need to do is to get well towel and cool the person's body with a well towel. You can also protect the tongue with a bandage spoon. You get a spoon, wrap it with a bandage, and put it between the tongue of the person and his teeth. Please do not administer drug for someone going through convulsion, but rather, after taking these steps, rush that person quickly to the hospital or call the medical personnel. Then, in the case of epilepsy, quickly remove the dangerous object about the person, lay the victim on their side until the person gains consciousness. When somebody is going through this challenge or through this sickness, please, whatever object that may cause accident around the person, quickly remove it from the person, from the side of the person, and then lay the victim on their side until they gain consciousness, and you can now you may now call on the medical personnel for further treatment. Okay, so we shall be drawing the curtain here today. I hope you have learned something about the first aid, its application, and its objective. All right, thank you for watching and have a wonderful day. Bye for now.